Circle of care. What is a circle of care? Circle of care is the network of professionals that supports a person during a healthcare visit. It includes healthcare providers such as doctors, nurses, and social workers, and together they collaborate to address the emotional, physical, mental, and social aspect of the healthcare needs of the patient. It is assumed um, it is assumed that all the individuals in the circle of care of a patient are automatically granted an implied consent. In order to rely and assume implied consent, all of the six conditions must be met. First, the custodian must fall within the category of the custodians entitled to rely upon assumed implied consent. Second, the personal health information in question must have received from the individual to whom the information pertains, or his substitute decision maker or another custodian. Third, the personal health information must have been received for the provision of health care to the individual. Fourth, the purpose of the collection or use of disclosure must be for the purpose of providing health care to the individual and to whom the information relates. Fifth, in the contents of a disclosure, the disclosure must be to another custodian. And sixth, the custodian that recovers the personal health information must not be aware that the individual has expressly withheld or withdrawn the consent. Release of patient or client health information. Basic Technically, there are two kinds of release of patient health information. It could either be for clinical or medical care, or it could be for secondary purposes. For basically, it is implied that health information can be released. For the clinical or medical care, it is implied that the health information can be released to health professionals that are inside the circle of care during a healthcare visit. It can be for any reason, such as a consult, a referral, a transfer of care. There is also the collection of personal health records for secondary use. It is for lawyers and insurance. Lawyers may need health information for all sorts of purposes, but since the requests are often not urgent, an appropriate form of consent is usually required. The same thing goes for insurance companies. They must submit a proper authorization form that permits them from accessing any certain record. However, it's a different note for organizations that wants to use the information for planning and education in their own organization. A specific consent is not necessary as long as they use aggregate data or the patient has been identified. For research, sometimes they're able to use the identified data, but usually they would need a consent from the patient if their personal data would be used for research or educational purposes. Lockbox. What is a lockbox? The lockbox is a term commonly used to describe the right of the owner of health information to withhold or withdraw their consent to the collection, use, or disclosure of their personal health information for healthcare purposes. The individual may expressly instruct the custodian not to use or disclose their personal health information for healthcare purposes without their consent. The withholding of the information can be for a particular diagnosis, research purposes, or for a concealment of a particular from a particular custodian, like a physician or a social worker. There are restrictions from in a lockbox. If PIPA has permitted the collection or use of the personal information because the custodian or the organization strongly believes that disclosure is necessary for eliminating or reducing significant body harm to an individual or group of individuals. The restriction also cannot hinder a custodian from recording or collecting personal health information that is required by law. Code of Ethics. Code of Ethics. The first principle in the Code of Ethics is to strive at all times to provide services consistent with quality healthcare promotion and prevention. It basically means to always deliver services that support the quality healthcare promotion and prevention. Second is to strive at all times to protect the privacy, security, and confidentiality of health information in any form or medium. This involves promoting and maintaining the protection of an individual's right to privacy and confidentiality. Third is to perform duties diligently and offer only those services for which one is qualified. This basically means to preserve and protect the health information to perform duties diligently and offer only those services for which one is qualified. It basically means to only provide the personal information to authorized personnels to requesters that already received the consent. Number 4 is to conduct oneself in the practice of the profession so as to bring honor and dignity to oneself, the HIM profession, and the Canadian College of Health Information Management. It basically means to represent the profession to the public in a positive manner. Number 5 is to conduct oneself in an ethical manner consistent with the values of Canadian College of Health Information Management and report any unethical practices to the appropriate authority. It basically means what it exactly says, but the gist of it is to refuse in participating in any unethical practices or procedures. Number 6 is to strive to improve one's professional knowledge and competence through continuing education and lifelong learning. It means to aspire to stay always competent and knowledgeable in the field. Number 7 is to offer leadership and a proactive, innovative approach to advancements in the health information management and practices. It means to advance the health information management knowledge and practice through continuing education, research, publications, and presentations. Number 8 is to abide by the policies and bylaws of the Canadian College of Health Information Management and actively support its strategic directions. It means to follow the policies and bylaws of the college and to align with its purposes. Number 9 is to support and mentor students, peers, and colleagues to develop and strengthen the workforce of the profession. Recruiting, it means recruiting and mentoring students, staff, peers, and colleagues in order to improve the profession itself. Number 10 is to respect the dignity of every person. It means to demonstrate a high regard for the dignity and the value of each individual.